those that are involved in aspects of health, whether it's medical devices, whether it's infrastructure that's directly tied to public health, whether it's research and science, academia, or even into the pharmaceutical arena. So I think there's a vast opportunity with other partners that we can engage. And it's really been their energy that has kept this going. Nathaniel out of the academy, really carried this and helped kick this off. And then I threw the ball over to Steve, didn't tell him it was coming. So then he got just stuck with carrying the ball. And then Lisa's really been she's been the hammer. So I'll use that pun intended. She's been the hammer that's kind of kept this whole thing going and has helped bring in Colonel Peak as well. So my history very quickly, graduated in 1990 with Army ROTC scholarship, spent 8 years on active duty with the Army as a sanitary engineer, was stationed at Fort Sam, short stint in California, Hunter Army Airfield in Georgia, and then just about 4 years in Germany. And in that, I had the opportunity to work with the Air Force bioenvironmental engineers a fair amount. Once in a while, cross paths with the Navy, but got a pretty good feel for that community. Came off of active duty, got a master's degree, and was probably that close to coming back to the Army. And in fact, had also contacted the Air Force and looked at coming back on active duty after spending some time with the master's degree and then 4 years as a contractor, consulting back to DoD, but just really decided that my heart was still in the service arena, in uniform service, and almost came back and called the Army. They said, great, what do you want your order date to be? Called the Air Force. They said, fantastic, we can take you 1 October because we've already taken all our direct accessions. And then I talked to a friend of mine who was still on active duty with the Army, and he said, don't come back to the Army, go to the U.S. Public Health Service. And I said, U.S. what? So got hooked up with some folks from the U.S. Public Health Service, and as they say, the rest is history. And the Public Health Service has been stuck with me ever since. So it's been a great career. I loved my time with the Army. I loved the mission of public health, taking care of soldiers, sailors, airmen, Marines, and their family members. And then just kind of transitioned that clientele to the entire nation and what we do with the Public Health Service. About a third of our officers are prior service. All of us within the Public Health Service are medically aligned. So if you, for instance, if you took the Army, U.S. Army, and eliminated all of everybody except the Army Medical Department, and then you eliminated all the enlisted, I know some of you are thinking then you don't get anything done. But you eliminate all the enlisted, the officer corps and the AMED is about what you should conceive of the U.S. Public Health Service. So I quickly provided you my bio and a little bit of a bio of the Public Health Service. For those that were able to attend the SAMI last week, we were very excited to have the Surgeon General, Vice Admiral Adams, do the closing session. If you have not seen that, I'd recommend you take a look at it. Pretty big deal for us to have the Surgeon General close that out. I think it took us 100 years, but we got the Surgeon General to close out the event, and I think it was great for us and very timely. Unfortunately, we are in some challenging times within the United States for a variety of reasons. One definitely being the pandemic, and also the recent unrest. And we see some of the unrest just associated with disparities. Many of those are linked to health, and we've also seen those health disparities present themselves as well in the COVID-19 caseload and mortalities. So, and that's one of our big focuses. So I think it was very appropriate that we had the Surgeon General able to join us and we hope to begin this collaboration, kicking off the new century, and with Sammy, and expanding the fold into this health engineering arena. What health engineering means to me, I've kind of elaborated on initially, which is it's all of those components of engineering that deal with health. 2 years ago, I was the speaker at the NSPE luncheon where they do their annual awards. And during the course of that presentation, and then part of last year's presentation, the Chiefs panel, I made the case that the one thing that parents want for their children as they grow up is health. And as a society, that's the number one thing that we want is health. Parents love their children unconditionally. If you've had a 2-year-old or teenagers, you understand unconditional love. So the love is already there. What we really want society to bring is health, whether it's security and safety. That really is underpinned by health, whether it's infrastructure and commerce, roads, buildings. All of that is designed to ensure that commodities can get to cities and locales because that underpins health. So all of the infrastructure that we do, the communications we do, the telecommunications we do, the security we do, even everything that the Defense Department does, fighting and winning America's wars, on behalf of the country, that's about our safety and our security, and that's about health. And when we're supporting other nations, humanitarian assistance, that's about health. So I made the case last year that all of the other chief engineers and actually all the other services actually worked for me as a U.S. Public Health Service chief engineer, that they were actually just all my subordinates. General Semin, I think, had a bone to pick with that. But I tried to make the case that all of it was pinned on health. And so that's what health engineering means to me. It's everything that we do is underpinned by that foundation, that desire, that need as a human being for health and for community. How we are going to engage the industry, first, I think I see a first step is in building this collaboration with the uniformed service partners. I think they're the low-hanging fruit, at least they initially are for me. I've worked with, I know several of them. I've met a few additional, but I think it's easy for us to find that collaboration opportunity across the services, and then reaching out to the AEC community. I think we'll be able to do. There's obviously already a great establishment of the infrastructure side and all of those underpinnings, but I think we also have other sectors that we can bring to bear in whether it's device manufacturing, whether it's specific drawing in of safety considerations or medical devices, pharmaceuticals. I've already have kind of on my list of other folks to contact the biotechnology organization. Working from memory, I think it's www.biotech.org or bio.org. I also have the fortune of that my wife is a pharmaceutical attorney, so I can leverage her Rolodex as well and find some folks to contact to bring in kind of that more of a traditional health component. And then I think we've also got great partners on the science side of the house, whether it's the scientists or environmental health officers and environmental science officers. I think there are aspects of the work that they do that participate and complement what we're doing on the engineering side. So that's kind of where I'm at. I'm going to quickly turn it over to Brian and let him provide his background. Brian?
Great. Thank you, sir. Appreciate that. Good words. And thank you also for leading us down this road. I think it's high time, and so very inspiring. Likewise, I'll give a quick summary of where I've been, what my experience is, and then share some of my viewpoints on health engineering and how we can we can take this forward together and with industry. I'll also echo the thank you to all the co-chairs that have scraped this together out of nothing, really. And I know it's been a long time coming. It's been an idea, and I think we've got it. I think it's going now, and I'm excited about that. So I've been looking forward to this all week, all day. I will share some stories in a little bit, but I started in the Air Force actually as a civil engineer officer, and I did that for about 7, almost 8 years. Loved it. Very much can-do attitude. Got a lot of things done, but my calling, I think, my heart was as really more of a sort of a scientist and a geek than picking out carpet colors and things. So I cross-trained into the Air Force bioenvironmental engineering career field 20 years ago now. So, and I've loved that as well. And those two career fields actually, they complement one another. And we've taken a lot of recent steps to try to strengthen some of those relationships and abilities to collaborate just within the Air Force. But for me personally, it all came together shortly after. I was on the it's called a global reach laydown team, but it's a small team, Air Force team that goes in and establishes bases. And so this team, we landed in Balad, Air Force terminology of Balad Air Base, in 2003 and started it up from scratch. The Army had been there for a while. We got there in October, and the order came to stay in place, and let's establish a strategic airlift center here at Balad. So on that particular deployment is where all of these things came together. Clearly, I was there as a B, a bioenvironmental engineer, but I was resting heavily on the civil engineer upbringing I had for base laydown and bare base operations. And what I saw, everything came together right there. All that skill set. It's probably you couldn't have picked a better B, I think, to be on that team. One thing I saw there was the burn pit, big one, and it struck me as odd that we're still contending with this. And I get it's a wicked problem, but it just seemed at that time, 2003, it just seems odd to me that we can't figure out something better than these ginormous burn pits. And that stayed with me for a couple of assignments. So flash forward to 2008, 9 timeframe, I'm working here. I'm actually working Colonel Hammer's job right now that she's doing. And we're getting all kinds of pressure from Congress about the burn pit and the health effects of, and what are they, and what can we do better? And we were very frustrated at the time. The preventive medicine people, Army and Air Force, were very frustrated trying to gather a lot of sampling data, something that we could use to explain the risk and maybe even help advocate for engineering controls like incinerators and so on. But part of me was frustrated because it is very clear that this is not a right thing, right? It is, you can see with your own eyes, people's noses running and their eyes watering and coughing and hacking. I don't know that I need to do a ginormous air sampling study to say that we need some sort of engineering controls here. People are being exposed. And, but the engineer community on Air Force and Army needed that. They needed that data from us to be able to justify the resources, the money that it was going to take to install these big incinerators or some other engineering control. And so at that time, I looked at that as a dilemma. And I even, for several years after that, I called it the engineer versus health dilemma. And I like to think that I've matured in my thought process a little bit since then. And I look at that now more as a nexus, the engineering and the health nexus, where we come together. But these problems still exist out there. I've worked a lot of different things in my career that there's some facility related issue that needs to be repaired because it is causing some sort of health effect, whether that's mold in housing, radon, vapor intrusion, chrome 6 in an aircraft hangar, maintenance hangar, even things like a pool, a training pool for special ops people down at Lackland, and the ventilation and the disinfection thereof. Trying to use a pool for something that it wasn't designed for. So all of these things have been very frustrating and have just underscored, honestly, this need for the engineering community and the health industry to work together. I see it so clearly now. And then when you layer on top of that, things that are happening real time across the nation, across the world, as Admiral Steve pointed out, there is a need out there. I've seen the engineering community respond to that need. The climate question, the building of resilience into our water systems, into our wastewater systems, into our electric grids. That process has started. So that we also recognize that they're on the back end of some of those, if they go the wrong way, a climate issue could cause a lot of human suffering. And we need to be prepared to respond to that, prevent those if we can, but then also to respond to those in a way that, from an engineering and health standpoint, we provide that holistic solution. So there is a ginormous need. I think now probably, I can't think of a better time to start crafting and emphasizing, providing this area where like-minded people with common interests can come together and collaborate and move the ball down the field. So, and that sort of blends into my thoughts about we can't do this alone. DoD, we're great, but there's a big industry piece of this that we're absolutely reliant on and going to need going forward. Part of that, as Admiral Steve said, is that collaborative effect. We those of you who attended JETC last week, there was a big undertone of that we are in this together, DoD and industry. One team, one fight. But I also think that there's a place for innovation as well. Some of these things, as fast as technology is moving right now, I know that the civilian industry or the commercial industry is ahead in whatever area you pick. And we have to be able to leverage that for solutions across the board. So I think there's a big innovation piece to count on there as well. So I will shut it down now and turn the mic back over to Colonel Hanner. See if we have any other dialogue out there, or if Admiral Steve and I can continue to field questions.
Great, thank you, sirs. Really appreciate your feedback and your insight on the new task force. I don't mean to put Mr. Pelham on the spot, but I do see that he's dialed in. So it's great to see you, sir. Thank you for joining us. I just got off of a COI meeting earlier, and we talked about the SAME strategic plan and the 5 goals. And I feel like with our task force and looking at the members who've joined us, we're going to have some really good contributions to SAME. And our our biggest goal at this point as a task force is to really make the argument as to whether or not we feel the need to be a standalone community of interest. And I think just hearing from both of our leaders that is the place we want to be, and we do need help from the members to do that. So we're going to have a series of meetings coming our way. And I just feel like having our new vice president here running the COIs, if you don't mind just sharing some of your thoughts based on what you've heard from Rear Admiral Deezer and Colonel Peak, that would be really good to hear from you, sir.
Sure, that's great. Thanks very much. My name is Charlie Param. Admiral Deezer, nice to see you. I'm not going to call Brian Colonel Peak because he and I are peers from way in the past. And
Charlie.
Nice to see you, Brian. I wish that I didn't see you peeking up on video. I don't see your video, buddy. So anyway, I was an Air Force civil engineer. I retired in 2015 out of command at Nellis Air Force Base, and I've been a longtime SAME member, and I was just recently elected to being a national vice president. So I'm honored to serve in that role. And the way that they've asked me to serve this first year is to be in charge of the technical COIs. And so I will be the liaison between the COI leads, and including this task force, and the national leadership team. And so I look forward to being able to work with you all and hopefully help you generate a case that would help elevate this task force and ultimately transition to a COI, assuming the interest and the is there. And so there will be a lot that unfolds here over the coming months to try to build the case and generate the interest, and then we'll take it from there. And I'll leave it there. I also happened to last year, when I was one of the elected directors, I worked with Kathy Off and my colleague Sal Najumian, and I led the task force that put together this new strategic plan. So the 2025 strategic plan I'm intimately familiar with, and I believe that I'll help you all craft your message of how you would want to serve some of those objectives, which will be part of the consideration for if you become a COI. And so I'm glad to help and look forward to being connected with you.
Outstanding. Thank you very much, sir. I really appreciate that. And I do know that Rear Admiral Deezer, you probably have to go in about 5 minutes. If we can maybe take a question from the group, if anyone has a question for him before he takes off, we can take that now, and then we'll continue after he departs. Does anyone have a question? I don't see anything in the chat at this point. Okay. Okay. So yes,
I'll just jump in, Lisa, before I depart. Just on the slide that you have up there, just I'll mention a few of these folks that we have there. Michael Brennan is over at the VA. Actually, he is a dorm mate, classmate, university mate of mine. So he got pulled in whether he wanted to or not. And Charlie, similarly, Brian pulled you in whether you liked it or not. So we're going to probably hold you and Mike Brennan to task to champion with us this new collaboration. Also, Captain Hawkins out of Navy Marine Corps Public Health Center, just recently talked to him. We're going to have to step through some administrative pieces to figure out who the participant will be from the Navy, but I think Bob is going to be the likely person. He was very excited about it, very interested in the collaboration. Colonel Alec Smith, Alec might be on the call today. I was unsure at last contact what his other requirements were going to be, but he works with also John Resta out of the Army Public Health Institute, or whatever they happen to be calling it these days. That thing gets renamed faster than just about anything I've seen. But Alec will be joining us from the Army. Also have colleagues over at the Defense Health Agency that I think will get some participation from their Public Health Committee. I also see potential opportunities that we should plug in with BARDA and DARPA on the research and engineering side. So, part of this in conceiving this health engineering task force, I'm also looking at that cutting edge piece, that research piece, that new development piece, which is going to be a little bit unique. I understand that the industry side is often a bit more established technologies, things that are shovel ready, implemented, ready to go. But I think there is also a science and research component that we can share information and advance industry, advance academia, and advance the profession. So I'm also looking kind of for that research side. I've got approximately 100 engineers up at FDA working on a variety of different designs, whether they're medical devices or new chemical technologies, or they're to the point now where they're in the not too distant future will probably be able to personally print medications for people, where they'll use a 3D printer and they'll actually print a particular pill that's going to support whatever ailment or treatment that I personally would have based on what my genetic need is. So I mean, it's pretty remarkable when you start thinking about those types of things. But there's a whole safety side, a whole design side. The engineers are involved in all that. So that's part of that kind of another sector that I think is completely unknown in version to SAME. And we'll have to see where that goes. I'm not, that's going to be a negotiation and building relationships with those folks to see if that kind of sector, the engineering and research industry, is interested in participating. But I think it's very exciting, and I think it's a great opportunity for us to bring them in and kind of open up another whole field for the industry side. But I also think of it as opening up a whole new field for the next generations, and supporting our strive to develop the leaders for the future. We get into this idea of research and medical community as well, that collaboration. And if you heard the Surgeon General last week, I always state that physicians are just, whatever the physician may be, whether it's a doc, nurse, anesthetist, physical therapist, I say they're all just body engineers. So I think that's a way that we can expand the great work, the great support that SAME has provided to our industry partners this far. And I think it's a great opportunity for this next century. So with that, Lisa, I want to thank you again, and Steve and Nathaniel, thank you. I look forward to continuing the dialogue. Charlie, we'll probably try to have a sidebar conversation with you to have you help guide us in some of the next steps. I think your participation will be critical, and I know that Brian has a great strategic thinking, so I'm looking forward to working with him as well. So thank you all. I hope you all have a great afternoon.
Thank you, sir. Have a great day. Okay, just wondering if anyone else might have some questions for Colonel Peak or any of the co-chairs, myself, Steve, or Nathaniel. If you do, you can either chat or you can turn on your mics to ask any direct questions. Okay, and you can interrupt me at any time, so I'm going to keep on going. Just wanted to let you all know that we do have our next meeting for the members. It's going to be on the 18th of July. So we've scheduled our recurring meetings for the third Thursday of every month at noon Eastern time. So before the next meeting, you'll receive an email from one of us, the co-chairs, and we're going to provide you some information to help you prepare for the meeting, and we'll give you some topics that we'd like to discuss. So if you don't mind, I'm just going to go into some of those things, and Nathaniel and Steve, feel free to chime in. So as you know, I'm really grateful that Charlie's on the line with us at this moment. So this is really fortuitous. But we're going to really talk about our I'm going to say our need to become a COI, and what we're going to need from you all are your ideas. So one of the biggest things that we want to make sure that we do is ask the question, ask ourselves, how do we add value to SAME? And then to ourselves as health professionals. So we'd like to hear from you what kind of training requirements, professional development you all need to remain credentialed and certified in your respective groups. I'd really like to hear about your career fields, your path, because I know that we come in from different sectors of industry and of government, so that's going to be really telling. So we'll talk about those things in the future. Also, we really need to think about the 2025 strategic plan. It is amazing. There are 5 goals, and we want to make sure that we're meeting all. So we'll have to have a discussion on that as well. And then we want to look forward into education sessions, whether or not we become a COI. The other option is to become a working group and report to an existing COI. So that's another option. And whether or not we become that COI, we do feel that there are health engineering webinars and educational sessions, and even a track that perhaps we can create for JETSI next year or the following year. So some of these topics are things that we ought to discuss during our next meeting. I'm going to send that over to you all in an email. But if you have any ideas at this point, since there is some time, I would love to hear from you. So feel free to chime in, anyone. Okay, so we do have one question from a Mr. Matt Dunn. And if anyone has the answer, please do chime in. The question is, does the Bureau of Prisons have their own engineers that would like to participate? Does anyone have a point of contact with at the Bureau of Prisons?
Hey, Elise, this is Colonel Smith. Probably Admiral Deezer might have a contact for that, because I think the Public Health Service Corps provides the Bureau of Prisons their health care stuff. Over.
Good. Okay. I'll take that as a note. Go ahead.
This is Matt Gunn. I asked the question, and I'm just a civilian on a small post here down in Ventura, but our county is fairly clean relative to COVID-19, but it's dominated by Lompoc Prison in terms of stats of cases and things like that. And that's why I ask.
Great question, sir. Thank you. And I don't know if Steve might have the answer, but we can look that one up for you all. Thank you very much. Okay, do we have any other questions? Okay, so no more questions. We are just about 5, well, it's 13:05 here, so an hour your time, Eastern time. Let's see, I think I just saw something else pop in. Yes, Nathaniel, I think we are very excited as well. So I can cut this short and early. If anyone has any comments about this health engineering task force, the initiatives that I spoke about, if you'd like to add any other comments or thoughts at this point, they are highly welcomed. If not, I will cut you all loose and give you back your time. You can contact any of our co-chairs. Our information is on that slide below. We're also on our website. You see the link there. You can contact us at any time. Like I said, I'm going to provide an email to you all with some of the thoughts that we shared today. If you have any other initiatives that you feel that we should look into, please share that with us. I'm just going to ask one last time if Colonel Peak or Mr. Param has any questions, or even Colonel Smith. Thank you for dialing in, sir.
Elisa, I don't have any other questions, but I am interested in, you maybe already are going to put this in your email to all of us, but this idea of whether we, this task force becomes a community of interest or just blends into others. And so, you know my thoughts on that, but I was curious about what other people might think about that. We don't need to discuss it right now, but I think there are probably pros and cons of going each way.
I do agree with you, sir, and that's a really good point. If anyone would like to share your thoughts or feelings about that, go ahead.
This is Charlie. I think that Kathy Off is probably the best person to share her perspective about that. Sorry to put you on the spot, Kathy, but you've seen task forces come and go over time, and so you understand that better than anybody on the call, I imagine.
Well, yeah, I mean, I can talk about how a task force becomes a COI. I think what really needs to happen is that there has to be some proof of value to the membership. So I know, Alyssa, I owe you some demographic information. I still need to get, we were kind of busy with virtual JTC last week, but I will get some of that information for you from our membership department, because we really need to see what, how many people we're going to be providing value for, and maybe we will be able to draw people from the outside into SAME as well, and what that value is. So I think as you develop your mission, and I know you were on the call today and you saw the charter that the Leader Development Community of Interest put out, that would be a great reference when you can fulfill all of the things that they have included in their charter. I think that's kind of a good indication that you're ready. I know that there were a couple COIs that thought that maybe the health engineering task force could fall under them as a work group, but I'm not so sure about that. So I definitely think that you should research a little bit, especially like the environmental COI, what their mission is, and what kinds of things they're doing to see if that would be a good fit or not. Trying to think if there's anything else I should add. I definitely think, based on what Admiral Deezer has said and others, I really think it's its own subject, if you will, that doesn't necessarily fall under another one. But we definitely want to make sure that you're self-sustaining before you jump out as a community of interest. Does that make any sense?
That makes perfect sense, Kathy. I really appreciate you sharing that perspective with us. That's something that we all really need to hear, and we have to be realistic about where we're headed. I know that we add value to SAME, and I am hoping that we can become our standalone COI, but I think we're going to have to prove that in the coming months. And so we'll be in touch with you and Charlie and our leaders and of course our members, to make sure that we're on the right path, that we can all make that determination in the end. I'm very hopeful. I did mean to bring this up. The architectural, I can't remember the exact name of their COI, but the architects have already reached out to us and would like to partner with us on some of their initiatives too. So I think just for other COIs, knowing that we exist, and knowing, or even not just knowing, but inquiring about our existence and why we want to exist, I think it helps others so that they can collaborate with us and with them. So I think there's value to other COIs, and I can see, yes, definitely environmental folks, and even the facilities asset management pieces as well. So I think as we move forward, we can advertise ourselves a little bit more and just help others, by educating them on who we are and what we do. So there's yes, sir. Go ahead.
I'm sorry, I cut you off.
Nope.
Okay. Well, I was just going to say, as we move forward, I think, like what you said, and what folks have said here, is I do believe there's a need for a separate group of professionals to come together and support one another. There is a duality that those of us who have worked in this particular vocation for a while, we understand that this health piece, it is way more effective when it is embedded and part of the project, whatever that is. If you're building something or renovating something and so on. I had a good public health friend tell me one time that he knows he's successful when other people are doing his job for him. So that is one side of the coin. And that largely is how we have been operating for the longest time. To different levels of effectiveness. What is missing is the other side of the coin, I believe, where other industries might have places to come together and reinforce and support one another in what they're doing in a like topic. I don't know that one specific to this exists. As a matter of fact, I'm almost positive nothing like that exists. There are environmental health organizations and things out there, but they lean more toward the medical and maybe the clinical sides of things. So it's like the National Environmental Health Association and so on and so forth. The niche I think we are trying to fill is for those of us who maybe aren't so clinical and maybe more on the A&E side of the house, combating a lot of those health threats that are associated with infrastructure or facilities or whatever. Where is that? Where is that place where we can come together and trade thoughts and collaborate with one another? So now that's an internal, right? That's an inward look, the value to the professionals who are coming. But in a way, it's a bit external too, because I think, I have a career field right now of 1,300 folks or so. About 300 are officers, but 1,300 across the board are looking for somewhere where they can engage, and I don't think they have that. If we offered this up as a place, a health engineering task force, community of interest, whatever, I see a large appetite for that, not just within the Air Force, but across the board. So anyway, probably let more of my opinion slide than I needed to. But I did want to speak to duality of it. We're better when we're embedded, but in order to keep sharpening our own saws, we need a forum. We need a forum to come together and collaborate, and so on and so forth. Okay, over.
That's perfect, sir. I think by you sharing your thoughts and those comments really help us out. So that provides us the guidance and the inspiration we need to move this forward. So I really appreciate that. Okay, so I want to ask if anyone else has any other questions or comments. I would love to hear some of your comments. We still have a little bit of time here, 14 minutes. If you'd like to use up that time, this would be a good time to share. Anybody else?
Hi, Lisa, it's Steve.
Hey, hi, Steve.
Yeah. Hi. I just wanted to, jump in and thank everybody for joining the call today, personally. And definitely after trying to wrangle this on somewhat short notice, we had plenty of time, but, obviously for those that are kind of new to the task force and this is your first call, we got approved in November by the board of directors. And, you know, after November, you get Thanksgiving, you roll into the holiday season, and then we rolled into COVID. So we haven't had a strong start, you know, if you will, but we appreciate, you know, everybody jumping in and supporting this that's on the call today. And I just really want to thank SAME for hosting this and allowing us to, you know, launch this endeavor with them. And I really appreciate you, Kathy, and Eddie, and everybody else that's on the call from SAME and what you pulled off last week for the JETC. Just trying to manage this call like we're doing today has been a challenge for me, and I can only imagine what the JETC was for you guys. So thank you all.
Excellent. Yes. Go ahead. Go ahead, ma'am. All right, and I do echo Steve. Thank you for bringing that up. This is an incredible opportunity for us. So thank you, SAME, and Eddie. Thanks for dialing in. Sir Charlie, thank you for being there for us. We look forward to providing you all updates as we move forward. And yeah, we're very, very excited about it. So with that, if anyone else has anything to say, please do now. And if not, I will close the meeting, or I'll have Steve close the meeting. And you will hear from us via email, and you can contact us at any time at your convenience. So any last takers, any last thoughts, seconds? Okay.
Yeah, thanks, Alisa.
Yes, sir. No problem. Thank you for your leadership. Okay, well, I will give you all your 10 minutes back to your time. Thank you very much for dialing in, and we'll see or hear each other next month. Thank you.
Thanks, all.
Thank you.
Thank you.
Thank you.
Thank you, sir.